Is there one particular product you use most frequently? And if so, give us a little clue why you choose that product. And in answering that, I'd also like to know whose hand is behind the product in your practice. Is it your hand or is it someone else's hand? Dr. Taub?
Okay, so I would say I use primarily Perlane and Restylane. The reason being is the G prime. I started, I don't know, maybe about 5 years ago, really injecting volume as opposed to what I thought of as lines. And I felt that because I was injecting deep, I liked the fact that it wasn't distributed throughout the tissue. It kind of stayed where I put it. So I thought of it as more structural, like I was putting a strut in or lifting the tissue up. I am looking forward to having Voluma, which I think may be a big game changer. And I also, in the last few years, have incorporated Sculptra because I believe that there's many patients who are just too volume deficient to be properly treated with HAs. And now I'm thinking that the combination of HAs and Sculptra would be the ideal thing for many patients.
I don't have a particular product that I use. I'm thankful for all the products that we have. I think they all have their place. I look at them as paint on a painter's palette, and I look at the patient's face as something of art that we're trying to create, and I'm just thankful for all the things we have. I'm sitting next to Rebecca Fitzgerald, who is responsible for, the evolution of using Sculptra in my facial plastic surgery practice has been significant. Like Becky and Derek on the West Coast in Los Angeles, we can't afford to have a lump or bump on our patients' faces. And so I was late getting into that game, probably about 3-4 years ago, after I was convinced that thanks to pioneers like Derek and Becky and others on this panel, that they figured out ways of safely using Sculptra. And I'm a free agent, so I have the hand in what I choose to use in my practice.
Great, excellent.
Thanks. I have done a lot of work with Sculptra through an HIV clinic at Kaiser Permanente, a big HMO. We ran an HIV lipoatrophy clinic there for about 5 years, and I love the product, but I use virtually almost every product in every face every time. They get a little bit of a collagen stimulator and a little bit of an HA and a little bit of a neurotoxin. And I agree with Dr. Persky completely that it's a palette, and it's so nice to have so many different tools to address it. So I don't think that there's one particular product that's the be-all, end-all. I think all of them are tools to the same goal.
In Germany, we are lucky to have a much larger variety of fillers we can choose from, but mainly the main fillers I use is the Belotero range. We do not have only Belotero Balance, we do also have soft and intense. But what's special about these fillers is that they, due to their different density zones, they fit better into the tissue, and that's why you can treat them from a very superficial plane to deep planes. Of course, if you want to do volumizing, we also add either calcium hydroxyl apatite fillers or also volumizing HA fillers.
And who's doing your injections?
Of course, the patient is coming to see me, and that's why I'm doing the injections.
Good, thank you. I have a cupboard full, and I'm happy to have all the variety of products. I think we've really hit on key points here that all HAs are not created equal. I like the higher G prime stiffness of the Restylane Perlane family and use that when I need a little firmer product. I like the malleability and softness of Juvederm, and I would say that's certainly my go-to filler for lips and areas that I need that softness. I like Radius when I need a robust fill. For my elderly patients, I practice on the west coast of Florida, where we have my cutest patient's 94, and likes, needs a really robust filler to volumize that face. Sculptra is certainly a part of my package as well, because I think that it does magic that no other filler can do in terms of really that globalization. I like that I can inject it all over the face, and I really think it gives you an improved reflection of light off the skin, and much different than any other product that we have. So I, again, I believe the whole panel agrees, it really is the family of products that we use, and to do state-of-the-art filling today, it really requires understanding each product's capabilities and where and when to use that.